Welcome back to Meds Made Easy. My name is Tarun. Today we're going to be talking about Tizanidine, also known as Zanaflex. So it is for back spasms, actually not just back, but muscle spasms in general. Muscle spasticity is the official title for it. It is an alpha-2 agonist. Again, I don't want to get into the details of all that, but how does it work? So it works by whenever your muscles are spasming, that means there's an increased firing in the neurons. What this does is this slows down the firing of it. And so hence less firing, meaning less spasm action going on. So that's how it works. Really good medication. Would I consider it to be super strong or anything? No, it's kind of what I would consider like in the middle tier of spasm medications. Let's see here. The big caveat with this medication, again, I don't go over dosages or how many times a day you take it, because every doctor seems to be different. I don't like to step on their feet. But you generally take it several times a day. It's more on the shorter acting side of it all. And the big thing here is about whether you have food in your stomach or not. So the medicine absorbs quicker on an empty stomach. So again, your time to peak, which means what's the maximum effect you feel of the medication. If you don't have anything in your stomach, an hour, right? Real quick. If you had lunch, dinner, breakfast, whatever you've eaten, it takes about 3 to 4 hours for it to hit the max effect in your body. Duration of action, again, depends on the food and everything like that, but you're looking at, 3 to 6 hours is the duration of action. So again, if you don't have anything in your stomach, it comes on quicker and leaves quicker, right? Which is why you generally get it dosed several times a day. Let's see here. Pregnancy class C, which means, ladies, if you talk it through with your doctor, but if the benefits outweigh the risks, good to take it. Breast milk, officially there's no literature saying whether this thing is safe for breast milk or not. I did some diving deeper into it, and the medicinal chemistry of it is that it is a lipid-soluble molecule, and so lipid soluble means it can cross through tissue. So it looks like potentially it can cross into breast milk. So again, but you should be having these conversations with your doctor if you need to be on this medication while you're breastfeeding. And so beyond that, I'm going to put up a list of side effects here. The big things you want to watch out for are things like hypotension, which means like a low blood pressure, dizziness, dry mouth, asthenia, which is like a lack of energy. You feel on the ground. Watch out for things like that. If you have liver issues, this one is generally like a red flag medication. You don't generally take this when you have liver issues. But again, I don't know your full picture. You should talk through this with your doctors. Make sure everyone's on the same page, because a lot of people use different doctors for different things. Make sure you're all on the same page. As far as renal function goes, you can take this medication if you don't have anything. If you have anything other than severe renal issues, so if it's mild to moderate, you're generally fine. You can take this medication. If you do have some severe renal issues where your creatinine clearance is really low, then this medication is probably not preferred for you to take. But again, you gotta have these conversations with your doc. Guys, in the spirit of Meds Made Easy, I think this kind of covered everything I wanted to talk about. If you have any questions, concerns, leave them down below. It's a great medication. It's very cheap. So it doesn't break the bank, so I tend to really like this medication for people who don't want to take the hard stuff. Again, give us a subscribe, let us know how we're doing with these videos. We're just trying to help. And we'll see you next time on Meds Made Easy. Bye.